Good morning, children. So, after the completion of the first three chapters, today we will start the new chapter. So, one of the informative for the purpose of you people only. So, they have given this chapter. So, that is nothing but the fourth chapter, Reproductive Health. Okay. So, today we will start the new chapter. First of all, what is the meaning of reproductive health? Okay, according to the World Health Organization, okay, so what is the meaning of the reproductive health means, which can be defined as the reproductive health is a total well-being in all aspects of reproduction, that is physically, mentally, okay, and that is emotionally, especially emotional, behavioral and social. So this is very important. See, these 4 points are very important. According to the World Health Organization, the reproductive health means a total well-being in all aspects of reproduction. That should be, so that means physically they should be very healthy, emotionally also they should be healthy, behavioral wise also they should have very good, healthy, and socially. Then only it will be considered as they are reproductively healthy peoples. Or we can also say those peoples are reproductive healthy peoples. Then the meaning of reproductive health also. Got it? Yeah. When it comes to the reproductive health, what are the problems and strategies? See, first of all, the various problems and strategies of the reproductive health. If we discuss about all these things in that first one, which is comes the overpopulation. So let me tell you briefly. So thereafter we will continue this discussion. See, the increasing human population, especially young individuals, who determines the size, health and prosperity of the future population. This is very important. Okay, and these young individuals belong to different age groups such as puberty, adolescence and early childhood. Did you got it? They are all not, the same groups. The young individuals, they may belong to the different age groups such as the puberty levels, adolescent and early childhood. Did you got it? Then, and the that is health and education of these young individuals, as well as age of marriage and child bearing capacity of the woman, are some crucial concerns for the overall reproductive health of the human population. Are you understanding? This is very important. And see, by keeping in view the above concerns, the government of India initiated number of programs. Some of them are given. Okay, so here the India initiated the reproductive health programs, that is family plannings, in 1951. Okay, then see, this reproductive and health care RCH programs launched in 1997. Are you understanding? See, the wider reproduction related areas are in the operation under these programs only. Okay, so for what purpose these programs they will conduct? Especially here, the such programs deals with the following aspects. What are such programs means? The reproductive health, the problems and strategies. Okay, yeah. See, such programs deals with the following aspects, especially to give awareness about reproduction related aspects, for creating a reproductively healthy society. So this is very important. This is a big problem. If you don't give awareness only repeatedly, the children or those people, they will repeat the same mistakes. Okay, so after the problems, if you try to solve, that maybe sometimes may become different complications. Instead of that one, to give awareness about the reproduction related aspects for creating a reproductively healthy society. Okay, then the second one is very important one. So this is also known as you must have heard about. We have to educate people about birth control. If we simply tell, sometimes there are a number of cases they don't respond. Instead of that one, by providing awareness, okay, if we educate the people about the birth control, so they may change, isn't it? Their mental aspects, care of pregnant mothers, isn't it? The healthy children, when they will reproduce during the pregnant mothers, if they take care properly, then only they can take care of their children, isn't it? Then the post natal care of the mother and child. Post means after the pregnancy also, isn't it? This is also very important, so that we can avoid the deaths, isn't it? Then importance of breastfeeding. There are a number of cases they must have, generally having the different aspects in their mind with respect to the breastfeeding, so that we should tell them. That means we should educate those people about the importance of the breastfeeding. Then equal opportunities for male and female child. You must have heard about earlier. Okay, there are a number of cases they must have given, and now also there are some. People, some educated people generally they give more preferences to the male, but they don't give equal importance to the female child, isn't it? But if we educate those people with respect to this reproductive health, all these things, we can avoid and to provide the equal opportunities for male and female child also. Then finally, very important one, as I said, awareness of problems due to population explosion, social evils like sex abuse and sex related crimes also. Okay, because of all these things only, isn't it? So such programs in our India they get started. Okay, so sometimes I can also ask the two most questions. What are the aims of the reproductive health care? Problems and strategies. Then you should write all these things. Okay, fine. The next one is when it comes to the reproductive health problems and strategies only, the sex education. It is very important one, especially. Okay, what are the aims and needs of sex education in schools and colleges also? Not only in schools, including colleges. What are the aims and need of that is sex education? Okay, so to provide the right information about the sex related aspect, it helps to avoid the sex related myths and misconceptions. See, there are a number of cases. Okay, don't think that the misconceptions is only to the other groups of the science, except the science. Okay, so that not only arts and commerce students, including science students also, they must have different, the myths and misconceptions about the sex. So that if we provide the sex education, we can avoid all these things, isn't it? So that's why the sex education, and this is very important. Then the next one, to give proper information about reproductive organs, adolescence and related changes, safe and hygienic sexual practices. sexually transmitted diseases also. Okay, so this is very important because the number of problems it arises, okay, due to the lack of information. Then there are, the changes, physically and mentally changes happens during the adolescence because of hormonal influence. You must have studied earlier classes also. I'm only told you in the earlier, in the last chapter also. During the adolescence and whatever it is related to the changes happen physically and mentally, if we provide the proper information, then only we can handle those situations clearly, isn't it? And safe and hygienic sexual practices. So there are a number of cases. These, you must have heard about the sexually transmitted disease, STDs and AIDS. This all happens when due to the unsafe sex and unhygienic sexual practices. So that if we provide the proper information about all these things, okay, we can avoid the further problems. Got it? Especially this knowledge will save the young people from the misconceptions about the sex-related aspects and also help them to lead a reproductively healthy, happily life later. Okay, so that's why this chapter also given for you people also. Remember, did you got it? Yes. So here the population explosion and birth control. Before we are going to about all these things, let me to tell you briefly the knowledge about the birth control methods and care of the mother and the child. If we don't provide, so repeatedly there are number of problems arises. If we don't provide those information, what will happen? And what is the use? Okay, so first of all, I was telling about in the beginning only, providing scientific knowledge about the birth control methods, care of pregnant mothers, importance of the breastfeeding, equality of the sex, etc. to the fertile couples and the people in marriageable age group is another goal of RCH, right? Especially such knowledge would help them to bring up a socially conscious healthy family of the desired sex, isn't it? And I also told it the awareness about the social evils. Such awareness among the people will help build up a reproductive healthy society, isn't it? Yeah. So, but the problem is still, our India, we are facing a very big problem, that is a population explosion and the birth controls. So let us discuss one by one what are those problems. Okay, and what is the meaning of population explosion also. In 1990, okay, that means the beginning of the 20th century, the world population was around 2 billion. So that is nothing but 2000 million. By the beginning of 21st century, that is 2000, it rocketed to about 6 billions. Okay, so then why it happens? So that means in the last century, all around development in various fields significantly improved the quality of the life of the people. However, increased health facilities along with better living conditions and explosive impacts on the growth of the population. Isn't it? Yes. And if you see the statistics of these things, that means the population only. As I said, in India, If we take only in India, the population was nearly 350 million at the time of independence. It reached 1 billion by 2000 and crossed 1.2 billion in May 2011. So it means every sixth person in the world is an Indian. See, India is second in the world population after the China, isn't it? Yes. And according to the 2011, that is census report, our population growth rate was less than 2%. So that means every year for 1,000 people, 20 number is increasing, a rate at which our population could increase rapidly. Okay. So here are the reasons for population explosion. Why? That means this much of rapidly the population is increasing in India. So that is not increasing, it's an explosion. Okay. The reasons for the population explosion. First of all, as I said in the beginning only, the increased health facilities and better living conditions. Compared to the earlier, now we are having increased health facilities, isn't it? The government is providing the vaccinations and all, everything with a free of cost. They are providing healthcare facilities with a free of cost, isn't it? Then a rapid decline in the death rate. Okay, but what about the maternal mortality rate and infant mortality rate also? That is called MMR, and infant mortality rate also, it is decline. That means only increasing the number, there is very less number of them is decrease. That means a death we can be seen. Increasing number of the people in reproductive, that is reproducible age. So there is a statistical information that when we compare to the other countries, India is the youngest country. So that means the reproducible age of the peoples are more in number compared to the other countries. So what may be the problems? The population explosion. Due to the population explosion, what may be the problems happens? That is the impacts of the population, the scarcity of the basic requirements, especially that is food, shelter and clothing. You must have heard about roti and makan kapra. So the scarcity, it's a very big challenge to provide the food, shelter and clothing, like basic requirement to the all the peoples. Then the control measures. How to control this problem? Okay, so how to control this population explosion? Motivate smaller families by using contraceptive methods. That number of cases due to the misconceptions only, the government is providing everything, but still there are some group of people they are not ready to adopt. Okay, then you must have seen the advertisements in the media as well as in the posters showing a happy couple with 2 children with the slogan earlier. Nowadays it is became one. See the awareness people about the slogan, Hum do hamare do. That means we two, our two. Many couples have adopted a one child nowadays, and recently there are a number of people that are not ready to bear a children only, isn't it? Then, and also there is a statutory rising of the marriageable age, especially that marriageable age of the female to 18 years and that of the males to 21 years. and incentives given to the couples with the small families are two of the other measures taken to tackle these problems. So these are all the things uh, in India they are not taken very strictly. Okay, if you compare to the India to the other country like China, they have introduced very strict plan of actions. If they bear more than whatever the government is instructed, they will cut all the facilities, including the basic facilities also. After one or two child, whatever the government fixes the norms, if they bear more than children, they will cut all the healthcare facilities, including all government facilities. But the very big problem in India, from the beginning only, the earlier governments and present also, they are not ready to take strict action against a particular group of the people who bears more than 6, 7, sometimes dozens of the peoples, isn't it? So will they provide really to the all those children the good, the education? No. Again, really will they provide the very good food to all those people or the children? No. Again, will they provide, the generally, especially, will they take care with respect to all those aspects to lead in a good life in the society? No. So, instead of that one, if they, bear only one or two children, they can provide all the good health facilities, including healthcare conditions, education, everything. Okay, so that's why. So these are things I think the government will they should very strict and action about all these things, or surely in future we have to face very big problems about this system. Okay, and the contraceptive methods. Okay, so these contraceptive methods, they are also known as the family planning methods. First of all, let me tell you the meaning. What is family planning? Planning for a small family. Planning for a small family by adopting scientific methods of birth control. So that is nothing but fertility control methods is called family planning. Let me to tell you once again what is family planning. The planning for a small family by adopting scientific methods of birth control methods is called family planning. Okay, and these family planning methods or contraceptive methods nothing but the prevention of conception is called contraception, and the methods are adopted to prevent this conception are called contraceptive methods. Okay, but when it comes to the properties of an ideal contraceptive, how it should be? It should be, that means an ideal contraceptive should be user friendly and it should be easily available in the market, or it should be easily available to the people, and it should be effective and reversible with no or less side effects. It also should be no way interfere with the sexual activities, desire and sexual act of the user. And a wide range of the contraceptive methods are presently available, which should be broadly grouped into the following categories, namely natural barriers. You must have heard about this IUDs. Then oral contraceptives, injectables, implants and surgical methods. Did you got it? Yes. So these are all the some of the contraceptive methods present, what they are introduced, and from the all the aspects. The contraceptive methods are broadly divided into two types. Remember, the temporary methods and permanent methods. In that one, temporary methods, which is includes natural methods. Natural methods are also known as traditional methods. Then barrier methods, intrauterine devices, and oral contraceptives. Okay, which is also including injectables also. Then when it comes to the permanent methods, that is surgical or sterilization methods, vasectomy and turectomy. Okay, yeah. So why it is essential? The question arises, why it is essential? The birth control is essential to control overpopulation, maintain healthy family, provide better education, avoid population. Okay, especially control overpopulation and natural resources. So these are all very important. Okay, so let it be. So these things we will discuss in the next class one by one in detail. Thank you.